You know that feeling? When everything just piles up, work, family, just life, and it feels like, well, like it's all a bit too much.
Yeah, that sense of overwhelm. We all feel it sometimes.
Right. And we think about how we cope. But what about the people who are right there on the front lines, helping us when we're facing health challenges? I'm talking about nurses.
It's such an important point. We often see nurses as, incredibly strong, always
The
caring, but behind that, they're dealing with enormous pressures themselves, pressures that really hit their own well-being hard.
Exactly. And that's what we're really digging into today, the mental health and, well, the overall wellness of
I've
nurses.
got some really compelling material to look at.
We do. There's
And
a very powerful personal story, some context around how nurses are recognized nationally, and then several like really insightful research pieces. They shed light on the struggles, but also maybe some solutions.
yeah, we'll be hearing about Karen Pentuza's experience. She's an RN with, get this, 38 years under her belt.
Wow, 38 years.
Incredible. We've also got details on National Nurses Week for 2025. The theme is The Power of Nurses.
Okay.
And International Nurses Day is focusing on how caring for nurses strengthens economies. Plus, articles arguing for, proactive mental health support, not just crisis stuff.
And stuff on self-care, right? Plus that big McKinsey survey.
That's the one. Over 7,000 nurses surveyed. He gives us a really broad picture.
So our mission today really is to pull all this together, to understand where things stand with nurses' mental health, what's driving it, and importantly, what can actually be done to help.
And Karen's story is, I think, a really powerful place to start. It puts a human face on these bigger issues.
Okay, let's dive into that. Karen Pantusa, 38 years in nursing, 11 of those specifically with dementia patients. That's already incredibly demanding work.
Absolutely. And then layered on top of that, the experience of working through the COVID-19 pandemic. Her story really shows how stress just accumulates over a long career.
It really does. She describes these physical symptoms that were basically warning signs, right? Like terrible back and neck spasms.
Oof, yeah. Must have been agonizing.
And heart palpitations, stomach problems, and this intense anger she felt. It sounds like her body was just screaming under the strain.
And then that turning point she describes. 3 nights, absolutely no sleep, even with medication, and finding yourself just holding the bottle.
That's terrifying, a real crisis moment.
It really is. And thankfully, it seems, her doctor recognized just how serious it was, maybe even more than she did in that moment.
Yeah, the GP signed her off work, which sounds like it was absolutely necessary. But the recovery, she describes it as a really long, tough road.
Definitely. And it shows how deep the burnout went. Like, she couldn't even focus on reading something she loved. Even TV was too much.
Her brain was just overloaded. She mentioned finding some, like, small relief in TikTok videos, short bursts of content.
Yeah, which is interesting. But she also talks about the slow climb back. Therapy, getting medication right, and crucially, learning how to actually name her feelings.
And acknowledging her own strength, even when she felt completely broken.
That's huge. And the diagnoses, she eventually received severe burnout, anxiety, depression, and PTSD.
Mm.
They really hammer home the potential severity of the mental health toll in nursing.
It's a lot. And her advice is so direct. Deal with issues as they arise. Seek help. Accept help. Take time for yourself.
Simple words, but incredibly hard to put into practice sometimes, especially in that kind of high-pressure environment.
And we should mention the postscript, too. Her return to work got delayed because of a fall. Just another reminder of life's curveballs.
Right. But she did eventually make it back. Her whole story, spanning decades and ending in this intense struggle and recovery, it just perfectly frames the larger conversation we need to have.
Absolutely. And thinking about her experience makes the timing of things like National Nurses Week feel even more relevant. It's May 6th to 12th in 2025, right? A time set aside to recognize what nurses do.
Exactly. A time to acknowledge their indispensable role.
And that 2025 theme from the ANA, the power of nurses, hashtag the power of nurses. It's a strong statement about their impact.
It really is. It makes you think, though, what does that power mean when the workforce itself is facing such significant internal struggles?
That's a really good question. And the international theme adds another layer.
Right, from the International Council of Nurses for May 12th, caring for nurses strengthens economies. That shifts the focus a bit, doesn't it?
It does. It frames supporting nurses not just as like the right thing to do, but as an economic necessity, an investment in our communities.
How do we make that economic case resonate within health systems, though? That's the challenge.
Well, these recognition weeks are definitely about saying thank you. which is vital,
Yes.
but they also highlight the dedication, the service, the sacrifices nurses make every single day.
And it actually took quite a while for this formal recognition to happen in the U.S. There were pushes back in the 1950s.
Really, that early?
Yeah, various attempts. Then the ICN established International Nurses Day in '74. And President Nixon actually proclaimed a National Nurse Week that same year, too.
Oh, okay.
But it still needed more advocacy through the '70s and '80s. There was a Nurses Day in New Jersey lobbying by nursing groups. Finally, President Reagan recognized May 6th as National Recognition Day for Nurses in 1982.
So it was a gradual process.
Very gradual. Then in 1990, the ANA pushed for the whole week, and by '94, those May 6th to 12th dates were locked in.
And now we also have days for student nurses and school nurses within that week.
Right, highlighting the different facets of nursing. But, the length of that history, it kind of underscores how long it's taken to formally value a profession that's just so fundamental.
So we have the celebration, the acknowledgement, but the sources we're looking at really pivot to this urgent need to address what seems like a systemic crisis in nurses' mental health.
Yeah, that article promoting nurse mental health really argues for a big shift, moving away from just reacting when someone's already burnt out towards, actual prevention.
For too long, it feels like burnout was seen as like an individual problem, like someone just couldn't hack it.
Exactly. Instead of seeing it as a sign that the system itself has problems. And the WHO now classifies burnout as an occupational phenomenon, which is important.
Okay, so what is burnout officially?
It's got three main parts: feeling emotionally drained, totally exhausted.
Yeah.
Then depersonalization, that's like feeling detached, cynical about the job. And finally, feeling like you're not effective anymore, like you're not making a difference.
Got it. And the stats comparing nurses to the general public, they're pretty concerning, aren't they?
They really are. Research consistently finds higher rates of depression, anxiety, and sadly, even suicide risk among nurses in the U.S. compared to everybody else.
And that link between nurse depression and self-reported medical errors, that's a direct patient safety issue.
Absolutely. It highlights the ripple effect. And then COVID just threw gasoline on the fire, didn't it?
Yeah, Karen's story showed that vividly. We've seen jumps in burnout, depression, anxiety, PTSD, all exacerbated by the pandemic.
And in the worst cases, leading to suicide. Tragic.
The article really points fingers at systemic issues, right? Stressful work environments, bullying.
Workplace bullying is a huge one, unfortunately. And just cultures that don't really prioritize well-being. Compassion fatigue is another big piece of this puzzle.
That's compassion fatigue, exactly.
It's like emotional exhaustion, specifically from constantly being exposed to trauma and suffering. It can lead to reduced empathy, just feeling numb. It's related to burnout, but has that specific trauma component.
Okay, so it's a far cry from just saying someone couldn't cope.
Miles away. That view is outdated and, frankly, unfair. These are systemic pressures.
And the fallout from poor nurse mental health is huge. It hits the nurses themselves, obviously, but also leads to high turnover, which costs hospitals a fortune.
And, crucially, increases risks for patients. It impacts the quality and safety of care.
That McKinsey survey you mentioned earlier, the one from 2023, it found that burnout and mental health challenges were still really high, right? No real improvement from previous years.
Depressingly consistent, yeah. Still a major, major issue across the board.
And didn't it say something about COVID infections among nurses?
It did. Over half, 57%, reported having had COVID, and 11% of those had long COVID. That's another layer of health challenges potentially impacting their ability to work and their overall well-being.
Wow. And nurses newer to the job reported being more dissatisfied and burnt out.
That's right. Less tenured nurses seem to be struggling even more, which is worrying for the future of the workforce.
But maybe the most alarming stat from that survey was about getting help.
Yeah. Roughly 2/3 of the nurses weren't getting any mental health support.
2/3.
And over half, 56%, said they believe there's a stigma around seeking help in nursing.
That stigma, it's such a huge barrier. What do you think drives that specifically in nursing? Is it fear of judgment, career impact?
It's likely a mix of things. Maybe a culture of stoicism, fear it'll be seen as weakness by colleagues or managers, worries about licensing boards, maybe even just the lack of time and energy to pursue help. It's complex.
And this isn't just about mental health, is it? Burnout affects physical health long-term, too.
Definitely. Increased risk for all sorts of illnesses, which then leads to more costs, personal costs, societal costs through lost productivity, and costs for healthcare organizations trying to retain staff. It's a vicious cycle.
Okay, so it's a bleak picture in some ways. But what about solutions? Pathways forward?
Well, that Promoting Nurse Mental Health article really pushes for system-level changes, focusing on prevention, creating cultures of wellness.
Not just putting out fires.
Exactly. Building fireproof structures, metaphorically speaking, addressing the root causes within the organizations.
And there are things that actually work, right? Evidence-based approaches.
Yes. Things like mindfulness, just being present, aware without judgment, enhancing resilience through practices like gratitude, forgiveness, self-compassion, and cognitive behavioral skills, learning to spot and shift those negative thought loops.
They mentioned a specific program, Mind, Body, Strong.
Yeah, it uses cognitive behavior therapy principles. And it showed real results with new nurse residents, better job satisfaction, less depression, anxiety, stress. So these interventions can make a difference.
It's good to see national groups stepping up, too, like
Yeah.
the AMA's Healthy Nurse, Healthy Nation.
The American Nurses Foundation's Well-Being Initiative, the National Academy of Medicine's Collaborative.
Right. They're doing research, providing resources, showing leadership cares, that visibility matters.
It absolutely does. But the article stresses it needs everyone involved. Nursing leadership, sure, but also policymakers, licensing boards, universities, and colleges.
A multi-pronged attack?
Pretty much. The National Academies actually laid out 6 specific goals and system-wide actions. A big focus was tackling stigma right from the start in nursing school.
Makes sense. Get them early. And wasn't there a mention of potential federal help? The Dr. Lorna Breen Act?
Yes, Sent 4349. That aims to provide funding specifically for healthcare worker mental health support, particularly related to the pandemic's impact. It's named after Dr. Breen, an ER doctor who tragically died by suicide during the pandemic's peak. A stark reminder of the stakes.
Definitely. So while all these big system changes are hopefully happening, there's also the individual piece, right? Self-care.
Absolutely critical. The Self-Care in Nurses paper really digs into this, because even with system support, the job is inherently stressful. Nurses often put patient needs so far ahead of their own.
Their own well-being gets lost in the shuffle, which, as we've seen, leads to burnout, lower job satisfaction, and something called moral negativity. What exactly is that?
Yeah, moral negativity or moral distress, it's the anguish nurses feel when they know what the right care is, what their patient deserve, but they feel blocked from providing it. Maybe due to staffing shortages, lack of resources, policies.
Okay, so it's an ethical conflict, basically.
A deep one. And it adds significantly to the emotional load. The paper lists so many stressors. Huge caseloads, workplace incivility, which is basically rudeness or disrespect.
Harassment, too, sometimes.
Sadly, yes. Plus constant exposure to sickness, death, even verbal abuse from patients or sometimes colleagues. It all adds up.
And the consequences stack up, too. Fatigue linked to mental health issues, poorer performance.
Poorer self-rated health, weight gain, high blood pressure, and just finding it hard to do healthy things. Even hospital food often isn't the healthiest choice, right?
True. Cafeteria options can be limited. It's ironic, almost.
It really is. And despite knowing all this, actively promoting self-care hasn't always been standard practice.
But supportive workplaces do make a difference. Good managers feeling safe to speak up.
Huge difference. Improves satisfaction, lowers turnover. Even just allowing nurses to express genuine emotions rather than bottling everything up can help.
Are there examples of things hospitals are doing?
Yeah, the paper mentions things like web-based wellness programs showing some good results, and addressing the physical stuff too, like back pain from lifting, the impact of rotating shifts on sleep. Those need attention.
And mental health support within the workplace, like those lavender lounges.
Right. Those are cool. Dedicated, quiet spaces for nurses to just take a breather when things get overwhelming. Sometimes just 5 minutes away can reset things. Fostering humor is mentioned, too, as a coping tool.
It's not just physical and mental, though, is it? Feeling accepted, spiritual well-being, that matters, too.
Totally. It's holistic. Feeling valued by your team is massive. But achieving work-life balance, that's still a huge hurdle. Long hours, overtime, personal life demands. It leaves precious little room for self-care.
Especially after the pandemic pressures.
Exactly. The paper mentions the work-life scale as a tool organizations can use to actually measure these pressures, the culture, the support systems, to see where the gaps are.
Okay, so what about concrete self-care strategies nurses can actually use? The paper gets specific, right?
It does. Mindfulness comes up again, that intentional, non-judgmental awareness of the present moment.
Benefits like better emotion control, less anxiety.
Yep, better communication, more empathy. And it doesn't have to be sitting cross-legged for an hour. Formal practices like breathing exercises or body scans are great, but so are informal things like mindful walking or yoga. Lots of apps and books out there, too.
Like Headspace or that mindful nurse book mentioned,
Yeah.
and CK, cognitive behavioral therapy.
Also key. That's about understanding the link between your thoughts, feelings, and actions. Learning to spot those unhelpful thoughts like, I can't cope, or I made a mistake, I'm terrible, and challenge them.
Developing more balanced thinking.
Exactly. Plus behavioral stuff like setting small, achievable goals or doing activities that bring you even a little bit of joy or accomplishment, behavioral activation, they call it. Again, resources like apps and books exist.
Then there's the basics. Physical activity and nutrition. Hard with shifts and stress.
Really hard. Unhealthy snacking is easy when you're stressed and tired. So strategies like just being more aware of intake, maybe prepping meals ahead of time, small things can help.
And sleep. So crucial, but so disrupted by shift work.
Definitely. Aiming for 6-8 hours is the goal. Sleep debt messes with memory, performance, physical health. The paper suggests things like limiting back-to-back 12-hour shifts where possible, encouraging quick naps during breaks.
Practical stuff. The paper also circled back to COVID's impact, didn't it? The fear, the distress.
Yes, acknowledging that specific layer of trauma. And it ends by reinforcing things like self-compassion, being kind to yourself, setting limits, which is hard for caregivers, seeking help, doing joyful things, even just brief meditation breaks.
Okay, so pulling this all together, what are the big takeaways?
Well, first, the mental health challenges for nurses are serious, they're widespread, and they're often tied to the system itself, not just individual nurses.
Right. And while recognizing nurses through events like Nurses Week is important,
It's definitely not enough on its own. We need more than just appreciation.
we need both those big system-level changes, prevention, better cultures, and support for individual self-care. They have to go hand in hand.
Absolutely, because nurse well-being and patient safety are completely linked. You
Yeah.
can't really have one without the other.
Which brings us back to those themes, doesn't it? The power of nurses.
And caring for nurses strengthens economies. It's not just feel-good stuff. It's a fundamental investment in our health system, in our society.
So, for you listening, maybe take a moment to think about your own interactions with nurses. Consider the incredible pressure they're under.
Yeah, and think about how you might show appreciation or even advocate for better support, maybe in your workplace, if you're in healthcare, or just in how you interact. What can we all do to build a culture that truly cares for our caregivers?
There are loads of resources out there if you want to learn more. The ANA, the American Nurses Foundation, the things we mentioned today. Dig deeper if this sparks something for you. Look for local Nurses Month events in May, too.
At the end of the day, nurses are the heart of healthcare. Their resilience is amazing. But it's on all of us to make sure they're supported. Maybe we can take Karen Pantuz's advice to heart collectively. Address the issues, help nurses seek and accept help, and fight for the time and space they need to care for themselves. That's how we build a healthier future for everyone.